So how do you know if your hip pain is from arthritis or if it's from a muscular problem? First is the location. Hip arthritis is generally associated with anterior groin pain. That's pain that's in the front of your groin, kind of halfway in between your pubic area and the edge of your hip. That's actually where your hip is located. And sometimes you can also have pain caused from hip arthritis that's in your low back as well. These are the places that I would more frequently associate pain with, rather than on the outside of the hip. And although you can occasionally have a hip pain on the lateral side or the outside part of the hip that's a part of arthritis, it's usually the groin. Also, we look at the quality. And generally speaking, arthritic pain is persistent, meaning it is there all the time. And it's usually kind of a dull ache, kind of like a toothache feeling. It just doesn't really go away. It's not that sharp in quality, but it's persistent and it's just kind of always there in the background. Other problems would give you more sharpish type of pain that's more episodic and more pinpoint to one location. Then you have the timing of the pain, and arthritic pain is usually something that's associated with what we call startup pain. So if you're at rest and then you try to get up and move or do something, then you'll get an increase in your pain symptoms. Then, because there is less lubrication in between the joint surfaces, try to get up and get moving, the bone rubs on bone and you have discomfort then. In addition to that, you'll also have pain at rest, particularly when you're sleeping. This is a common feature of arthritic pain. And lastly, there are associated factors that you may notice with arthritic pain versus other sources, muscular sources. So if you have what we call crepitus within the groin, so this is a sensation of grinding that you can either hear or feel, a sensation of catching when you move a particular way, or if you have a significant loss of your range of motion of the hip, meaning you can't really move your leg that much, and especially outwards to the side. That's one of the first things to go. If you have any of these symptoms, this is sort of an indication that you should speak to an orthopedic surgeon and have your hip imaged. Hope that helps.